Good afternoon, eminent people sitting here. Really, if we go back to the 1980s, radiology was, I'm a radiologist, and I actually got involved with radiology in 1984 when I started my MD at PGI Chandigarh. And it was very rudimentary. We were probably at least 15 years behind our Western counterparts. Now, how radiology has changed over these years is the digitization which came into radiology has been the sea change, and the DICOM standards that developed, that brought about uniformity. I remember the olden days when, we would take films, then try to make slides out of them, and even for presentations or for sending across, it was a huge task. Today, not only is it possible in very, very cheap rupee terms to be able to transmit these images across, and they are heavy files, it takes hardly anything. I remember Lee's lines used to be 10 lakhs, 15 lakhs. Today, when someone wants 5,000, you are growling at him. So with that, development of infrastructure, development of the technology, exchange of the imaging and also pathology became possible. Also, we were able to store this data. I remember even till 10 years ago, picture archival systems in which we used to store these images, you used to talk of crores of rupees. Today, the same thing, indigenously developed, 5 lakhs, and that includes hardware as well as software. So this change in technology has also brought about the ability to do teleradiology, telereporting. And one of the banes of our country is that in the periphery, patients do not have access to healthcare facilities. Ours is a federal structure. There are states which look at healthcare, and every state we know has medical colleges, has district hospitals, has PHCs, and so on. The infrastructure physically is there. On paper, maybe even personnel are there, but nothing is working. I feel that through this telemedicine, teleradiology, telediagnosis, teletreatment, it may be possible to extend the reach of expertise within the country. We have satellites up there. The government is even willing to give you satellite time free in case you are wanting to get into these initiatives. And that's where I think a patient for an X-ray doesn't need to travel 100 miles to be able to do it. And so this possibility of being able to do whatever you plan to do is there in our country. The infrastructure is there, the technology is there, we need the will. And also, as there is explosive growth of healthcare, I think there'll be huge manpower shortage. There are already very few trained radiologists, maybe 10 or 12,000 in an entire country of 1.2 billion. And so I think these tele-initiatives are the way that we will be forced to go, even for some of us who feel we will lose touch with the patient. Maybe we develop softwares which can keep you in touch with the patient through cameras or whatever the way may be. Basically, our attempt should be to reach as many people as possible with as few available strength of doctors, but at the same time also see that doctors don't become a commodity. That, we are cut off sitting in a swanky office somewhere and we don't know what's happening to the patient. That should not happen. And that's a concern for me as a clinician. Thank you.
Thank you.